Right. Experts on climate change have urged President William Ruto to ensure proper public participation ahead of the planned livestock vaccination exercise scheduled for January. They warned that honoring key procedures could negatively impact livestock health. This comes amid widespread rejection of the initiative by Kenyans, particularly among pastoralist communities, who fear potential risks to their animals.
Talking about mitigation, greenhouse emissions, methane, or we are talking about adaptation because it is our priority as a country.
The livestock vaccination campaign spearheaded by President William Ruto continues to face mixed reactions resistance from various sectors, with the issue being a key topic at Wednesday's Editors Guild luncheon, which focused on climate change and financing. Climate change experts arguing that the government should prioritize helping pastoral communities adapt to climate change rather than focusing on livestock vaccination.
We know my cow will not die even if it is not vaccinated. I know that. They have not died all that time. So what is the priority? Is it vaccinating them or giving that money to FLOCA so that it can increase the share to these counties which need that money? So that's my position. It is my personal position, but we are really worried. Let us, if it is good, let us create awareness.
However, while defending the government's stance, Kenya's Special Climate Envoy Ambassador Ali Mohammed has emphasized that the vaccination exercise should be treated as a vital initiative. The experts shared their views during the Editors Guild luncheon, where journalists were encouraged to educate Kenyans about climate change and its impact on both the population and the environment.
I don't understand the politics of it, but vaccination, whether it's for human or for wildlife or for animals, I think it we've been doing. I have been vaccinated myself as a child. I have vaccinated all my children, and I'm sure all of you have been vaccinated. And it's important that we adapt and accept the technologies that are available.
Don't shy away from sharing the truth about it. Because from our poor village in Bungoma, I have 3, unlike Mithika was 5. I have 3, and I'm reluctant to do it. To vaccinate them.
On Tuesday, President William Ruto challenged those opposed to the exercise, urging them to present alternative solutions for how the program should proceed.
How do they intend to get rid or to do disease control? If it is not vaccination, what is their alternative plan? They should tell us. Badala ya kutuambia mambo ya sijui hiyo maneno imesemekana hapo.
Later in the evening, the Kenya Veterinary Association, however, presented recommendations to President William Ruto, urging the government to postpone the vaccination campaign. The association calling for more time to educate the public and address concerns raised by Kenyans. The association says that before the campaign begins, the government should adopt a risk-based approach, prioritizing diseases that are endemic to specific areas, rather than conducting blanket vaccinations for diseases that may not be a major issue in certain regions. It also proposed that the government should impose stakeholders' engagement, ensuring that all parties involved, including veterinary professionals, farmers and local leaders, be part of the process. But to address doubts about the process, the Kenya Veterinary Board confirmed on Wednesday that they are fully prepared to carry out the vaccination campaign, relying on their expertise.
The veterinarians, the veterinary practitioners are prepared to carry this exercise because they have the competence and they have the knowledge to do so.
1.3 trillion worth of the sector requires that magnanimous steps are taken. Botswana, for example, the government of Botswana took the mandate to ensure that all animals are vaccinated in Botswana.
Paul Kirobi, TV47, Nairobi.